Welcome to another Let It to Louie segment with Abby Algiers. Welcome back, Abby.
Thank you, Sally.
We are currently headed towards summer, and your father wrote a really great piece about being confined to a treatment center and how that he has dealt with that and how the people that were in there dealt with being confined.
Right,
And
right.
that is something that, can happen pretty much to anybody depending upon what's going on medically with you.
Right.
So it was a very interesting piece that you find, and let's hear what that letter is, and then we'll talk about it.
Okay, great. Thank you.
You're welcome.
Another confined to the treatment center. Dear Louie, a number of years ago, nearly a half-century ago during my residency, I was privileged to hear words of wisdom from an unexpected source. If you've heard this before, forgive the repetition. As I recall, we were making ward rounds on the Old West Communal Ward in Milwaukee General Hospital, and we were rounding in a 4-bed ward. The patients were 4 old women, old at the time, about 70 to 75, and were suffering from diseases of the aged, from urinary tract infections to congestive heart failure and probably other chronic afflictions. At that time, patients were hospitalized for days on end, were treated quite vigorously, sometimes in retrospect inappropriately, and consequently for a significant time. During that time, a casual attitude was adopted, an attitude initially of hope and optimism, but later of mature insight and awareness of the downside of chronic disease with the inevitable elderly, congestive heart failure, multiple pulmonary emboli, and death. The process was played out too often, but on occasion, a vigorous old woman would maintain and recover. This individual would have just been a bit more vigorous, more aware, and although not almost always demonstrative, be just a bit more observing and sometimes most observant. A real fooler. One such patient had recovered from multiple disease entities and was awaiting discharge back to Unit 2, a long-term facility. She sat quietly in her chair, an old wicker wheelchair with the high back and pushing rod, dressed in the striped gown of a Unit 2 patient, holding her belongings as she awaited transfer. We warded around her, spoke over her, pushed the chair from the adjacent bedded area, and nodded to her, wished her well, and set her up for an outpatient visit. She was for all intents and purposes, on her way back to the long-term old folks' home. The women of the 4-bed ward had been subjected to a rather violent upper respiratory infectious disease, and the mortality had been high during the past number of weeks. Our patient had been a vigorous survivor, had been most quiet on her stay, but had always been alert and with shiny eyes had penetrated the ward rounds and, unknown to us, had assimilated to the medical jargon. That morning, one of the ward occupants had taken a turn and was being placed on the last medical rites, a concoction of high-dose penicillin, intravenous chloromycetin, and gamma globin, a concoction only sometimes effective, many times expensively ineffective, and death took over. She, with the penetrating eyes, had heard, observed, and I suppose documented the deaths which occurred in spite of the heroic doses of antibiotics and other supportive medications. She knew of the outcomes and probably of the futility of care. She was well aware, and we were not aware. It was such a surprise when out of her wheelchair confinement came a little voice. In response to the resident's orders for 1 million units of penicillin, 2 grams of chloromycin, 100 milligrams of salomedrol over the next 12 hours. Her voiced response responded with insight and some authority. Aha, another kiss of death. The remainder of rounds was very quiet. The remarks were discussed at residents' rounds, and some insight was gained. Over the years, her remarks have been thought of many times, and a certain humbleness has replaced the cocksure attitude of the second-year resident. This week has given insight again into an attitude of treatment in what had been treatment failure. treatment failure of modern medicine, failure to be able to change the course of the modern Black Death, the death of so many minds, the modern scourge of advanced cognitive disease, Alzheimer's disease. One of our own, one of the class of 44, has been admitted to the Cedar Lake campus for management of aggressive Alzheimer's disease. This classmate is following the course of his older brother. He's following the course and is aware of it. As I recall, and neither of them has been a patient of mine in the past, the brother developed a highly malignant, aggressive, belligerent, difficult to manage form of dementia. He was confined, over my dead body, to the Dodge County Home for Mental Illness and there remained. During his stay, our classmate worried. There seemed to be a family problem in the past. He voiced his concern many times to me, his worry of the disease. And now it appears that, another kiss of death is occurring. This business of aging, Louie, is distressing. However, on occasion, like last night, when Gomez of the Brewers leaped high into the sky in the outfield, against the fence and against all odds, to catch the baseball and save the game, on those occasions, all are young again, and the martinis taste better, and hope springs eternal. And the elderly lady in bed, too, with the dark penetrating eyes and great insight, might just not always be right. So, as always, Louie, keep the faith.
You know, your father ended a lot of his letters with keeping the faith. And in this particular letter, they're talking about the aha moment, right?
Right.
And I believe at this point, 2025, that we can reverse course of some of those diseases that were very common in just recently, the 1990s even.
Sure.
And thank goodness we have science and research. But keeping the faith is more mental than actual medicine, and trying to not go down that road of, okay, this family member had this family member had that,
Right.
What's in store for me, and trying to maintain your own mental health as long as physical health as well.
Right, and I think we all do have that power. It is the power of the mind. That was one thing my dad always stressed was you have to believe it. You have to be positive, have a positive outlook on what's going to happen. And I think a lot of his patients thrived because of it, and it helped he and my mom, I know, in their later years for sure.
I agree with that, because I know that in this writing he was saying how cocky he was at the 2-year resident
Yes.
coming in, and how this opened his eyes to maybe there is something else, maybe there is some type of change. And I know that later in your life your father had to deal with some type of cancer, and the doctor said, well, we usually don't treat it.
Right.
And he said, well, we are treating it.
Yes.
And that really did prolong his life. So again, having that mental health as well as the physical health, but also being your own advocate
Yes.
is important.
And not always listening to your doctor.
Right.
And as my dad's perspective of what occurred with that woman, just showing that patients are listening. People, and just for all of us, people are listening to the words we say, so we need to, choose them wisely and
Right.
not write anybody off or,
Yeah, especially with his friend that was talking to him about worrying about this is probably going to happen to me, and being aware of that. I think family history is really important, right?
Definitely.
But I also think that if you can figure out a change of course, whether it's a change of course, and we're not going to dwell on this, we're going to try to do what we can to prevent it and try to move forward from there, is huge. And I think that a lot of that thought process has changed from the 80s and 90s.
Definitely.
to we're not going to just succumb to this. What can we do? Let's get some more opinions. Let's not just be focused in on maybe one healthcare professional.
Right. And what can we do? Diet, exercise, lifestyle, it all plays into the picture.
And keeping the faith.
And keeping the faith, right?
Thank you for coming in.
Thank you, Sally.
You're welcome. And to our viewers, as always, thank you for watching.